I wonder if I should move.
I'm hearing some noise in the background.
You have been?
Right now I am.
Okay. So I'll just mute myself.
Thank you. Okay, are we ready to get started?
Welcome.
I'm gonna pop this into the
Yes.
chat. We have one guest. Okay. All righty, we are going to go ahead and get started this morning. Good afternoon, everyone. For those familiar faces, hello again. For those new faces, welcome. My name is Kendall Lee. I am the Program Administrator of the Maryland Emergency Preparedness Network. The EPN is an emergency preparedness communication network operated by the Maryland National Capital Home Care Association, otherwise known as MNCA, in partnership with the Maryland Office of Preparedness and Response within our state health department. We provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I'd like to extend my gratitude to Executive Director Caitlin Hauk of the Maryland National Capital Home Care Association, who's with us on the call today, and the staff at the Office of Preparedness and Response in our state health department for their ongoing support. Your partnership makes this work not only possible, but very impactful. At the EPN, we are dedicated to making you MD ready. And to achieve this, we must begin by being Baltimore strong. So today, in honor of National Preparedness Month, we are thrilled to partner with Baltimore City's Health Department and the Office of Emergency Management within the Baltimore City Fire Department to host this preparedness-packed event. In this presentation, you can look forward to our guests sharing valuable preparedness tips and resources to enhance your readiness and response efforts. I'm incredibly excited to introduce our panel of speakers, but before I do so, let's cover just a few housekeeping tips. So for the recording, today's webinar will be recorded. You can expect to receive the link to the recording following today's event. Additionally, it will be made publicly available both on our website and our YouTube channel. As for the audio and camera portion of today's event, you will have complete control over your microphone and camera settings. While we kindly request that participants remain muted during speaker presentations, we do encourage active participation. So we invite you to unmute during the interactive segments. Additionally, you're warmly invited to activate your cameras and connect with us today. We'd love to see you, though it is not required. As for the Q&A, we encourage questions. Please submit them into the chat box, which will be managed throughout the presentation. There'll also be a portion towards the end, specially dedicated to questions. Last but not least, finally, I am thrilled to introduce our panel of speakers. With us today, we have Bridget Wright, Community Health Educator from the Office of Public Health and Response in the Baltimore City Health Department. And then from the Office of Emergency Management within the Baltimore City Fire Department, we have with us Deputy Chief Preparedness Officer Crystal Bright and Preparedness Officer Michelle Smith. Join me in welcoming our guests. And I'm going to hand the metaphorical microphone over to you.
Thank you so much for having us today. Just again, checking to make sure you can see the PowerPoints. First slide.
Yes.
Alrighty, excellent. Thank you.
Thank
Again,
you.
this is, I don't know if you can see me, but this is Shelley Smith, the Preparedness Section Chief. So let's get into it. So when we're sitting here today, we're going to wonder, what is OEM? Because a lot of times people don't know what Office of Emergency Management is, because we tend to step in when emergencies are taking place. So just a little background information on what OEM is. We are a division within the fire department, and we assist the city with field response efforts to major incidents and emergencies that can happen in the city at any point every single day, 24/7, 365 days a year. At the events, we can offer logistical and tactical support to first responders and city agencies during incidents. And we engage in community preparedness, education, and outreach. And then we manage the city's Emergency Operations Center, which we refer to as the EOC. And what this is we basically bring people into one room, all of the different city agency partners, leaders, to have them come in to provide support to response efforts or even blue sky special events, just to make sure if anything needs to be addressed, we're all working with each other to make sure that we are utilizing each other's resources and not trying to outsource to companies or what have you, because we do have resources each other can use.
OEM's mission. OEM and OEM, the Office of Emergency Management, we aim to protect Baltimore citizens, its workers, visitors, and the environment from natural and man-made disasters. Here at OEM, we prepare the city and public for emergencies. We coordinate interagency response and recovery, and we maintain a comprehensive program of disaster mitigation, preparedness, response, and recovery. Our vision at OEM is to have well-prepared households and businesses, resilient communities, integrated, efficient, and rapid response recovery.
Hello and good afternoon, everyone. Hi, my name is Bridget from Baltimore City Health Department. It is the mission of the Baltimore City Health Department to protect health, eliminate, of course, disparities, and enhance the well-being of everyone in our community through education, which I take part in, educating the community, coordination, advocacy, and direct service delivery. Our vision, an equitable, just, and well Baltimore, where everyone, all the citizens of Baltimore City, have the opportunity to be healthy and also to thrive. These are some of the things that the Baltimore City Health Department Office of Public Health and Response are responsible for. And what we do, we coordinate emergency response activities and maintain Baltimore City Health Department emergency plans and protocol. We have many plans for Baltimore City, including, of course, the COVID plan for COVID that we were in deep for 2.5, 3 years, all the time of COVID. We engage in emergency planning activities with local and state agencies, hospitals, and other healthcare organizations. We are involved in these activities at different times of the year. We also conduct outreach to city residents and community leaders to help prepare residents for emergencies and disasters, which is my what I do at Baltimore City Health Department for our office. We also partner with city, state, and private partners and community groups to help meet the needs of the public during emergencies. And we direct emergency preparedness training and drills for Baltimore City Health staff. And we do this a number of times each year. Thank you. Why should we plan? Michelle, is that you?
No, this is you, Ms. Bridget.
Oh, okay. Well, I'm sorry. Why should we plan? We plan to be ready for the next emergency. The next emergency is going to happen. If we all live long enough, the next event is going to happen. And I believe that we are preparing for the next, I believe that preparing for the next emergency is imperative. Why? Because it's only a matter of time before the next emergency happens. Because if we all live long enough, we will see it happen. And of course, we want to ensure that you, me, our loved ones are going to be safe and our needs are met during the next emergency event, because it's better to plan and, of course, hope and pray that nothing happens. But at least if we have a plan, we are ready. Next slide.
So when we are looking at planning for disasters, we want to have individual emergency preparedness and preparedness plans. And what this involves is preparing for a range of potential hazards, emergencies, and disasters to ensure that not only we are safe, our households are safe, and those we support are safe. Within emergency management, we want to take an all hazard approach to planning for emergencies so we can have plans for any possible emergency that the city may encounter. And we encourage when people are planning for their own households to also prepare and plan for any possible emergency that can possibly take place. So, what should we prepare for? When we're looking at what kind of disasters and incidents can happen, we're going to have things such as natural disasters. And what we have here are these are any kind of weather event, might be a biological disaster. So on this slide, we've got a couple pictures here of things that the city has experienced, and some that we haven't experienced, but we can possibly experience. Obviously, we get a lot of thunderstorms. We have had flooding in the city. We have both sporadic flooding that can be associated with a random summer storm, as well as a hurricane. In the upper right corner, you see an image of a hurricane, and that is, I believe it's Hurricane Isabella, an image of it coming towards the Baltimore region. And next you have a picture of a downed tree from another storm on a Baltimore City resident's vehicle. And then the tornado is not from Baltimore, but an image from Baltimore, but it is very possible that we can have tornadoes in the city. And then of course, as Ms. Bridget mentioned a few minutes ago, we can experience biological pandemics, epidemics, just like we all went through with COVID. So man-made disasters are things that can involve any kind of human actions, whether it be an accident, like a hazardous material spill that can impact the elements, whether it be the weather, not the weather, whether it be the air, the water, anything like that. So that's something we want to prepare for. We also want to prepare for wildfires, which we don't experience as much in the city, but it is a possibility and it is something that we prepare for, as well as structural fires. We do have a lot of fires within the city, unfortunately. And then looking at cyber attacks, that is another big one that the city has faced. And I think it was in 2016, we had a very large scale cyber attack that impacted much of our operations within the city. And then one of the biggest man-made disasters, unfortunately, that the city has faced and does face because we have an aging infrastructure is various damages to our infrastructure, whether it be a tunnel collapse, a tunnel fire, and what we all remember from earlier this year when the Francis Scott Key Bridge collapsed. So what is the difference between an emergency and a disaster? This here's a picture of Baltimore City from June 22nd in 1972, and this is the bridge on Patapsco Extension. It connects Canton Avenue and Potee Street. And what you can see here is there's a river that has gone, it's completely covered it. And this was when we experienced Tropical Storm Agnes. And for this image here, we had over 7 inches of rain. So when we're looking at emergencies and disasters, they can both impact us, but emergencies tend to be things that can be addressed at the local level between the different emergency service professionals, whether it be fire, emergency, police, paramedics, so on and so forth. And it's things that can be addressed, like I mentioned earlier, a house fire, things of that nature. But if we have any kind of, whether it be a man-made disaster or a natural disaster, it becomes it becomes a disaster when we can no longer meet the needs to manage that disaster and handle the response and recovery efforts for it. So this would mean something such as a hurricane, other extreme weather events, some kind of storm that may destroy a number of our infrastructure or homes. And that would tend to involve not only just our state partners, but our federal partners with FEMA. So when we're talking about planning, one of the things that we want to make sure to clear with everyone is to first understand what's the difference between a watch versus a warning. This still confuses me, but the handy pictures that they have available that you'll see sometimes social media accounts post is the watch first warning, because people, I myself included, can get those confused. So with this graphic here, we show a watch is all of the fixins to have a crab cake, and a warning is actually the crab cakes are here, they're ready. So another way I try to think about this is if you have a watch, think about a watch on your time. A watch on your wrist, which means you have a little bit of time. A warning, there's no time. So that's kind of how I try to think about it to help myself remember.
How do we prepare? We prepare by getting informed, creating a plan for you and your family, building a kit, and practicing your plan. You are online now, learning about the items to have in your emergency kit and things to build a kit. So that's how you are beginning to prepare. Now that we briefly discussed why we prepared, now that we have briefly discussed why we prepare and what we prepare for, let's discuss the ways that we prepare. So getting informed. The first step in preparing is getting informed about the various types of emergencies. Excuse me, I'm getting feedback. I am helping other folks prepare at a senior symposium here at Hilton, Baltimore. So the first step in preparing is getting informed about the various types of emergencies and disasters that are likely to happen in our communities and how this would affect our lives. Once we know these risks, we need to determine what steps we take and resources we need to mitigate potential problems. Some of the resources that we have here, such as 311 and 988. 311 is a number where you could request resources for the city. 988 is a number you could get for mental health concerns, mental health needs or concerns. OEM's Be More Alert emergency mass notification system. You can sign up for notifications for alerts on your phone. BCFD smoke detector program. You could contact 311 to request a free smoke detector to be put in by Baltimore City Fire Department. We have DOT's Baltimore City evacuation route information there. Baltimore City Health Department emergency preparedness and response programs like Code Red and Code Blue. Our agency, OEM's free CERT community emergency response training course, and Department of Health and Community Development resources for homeowners. So those are some of the resources. Excuse me, give me 1 second. The older adults here, they know how to party in Baltimore City, that's for sure. So they have Debbie Allen. I'm here at Hilton, Baltimore. They have Debbie Allen that's doing a presentation, and I'm doing some tabling, providing information about being prepared. So back to the slide, emergency preparedness resources, state and federal. Some of the state resources are 211. A lot of people don't even know what 211 is, but that is a resource number for United. It's United. I have the resource card. Shelly, help me out, please. What is 211 number?
United so 211 is a state resource. It's similar to 311, but what they have is all of the various state health and human service resources that could be available based on the individual's eligibility criteria. And it can be anywhere from finding out how to apply for food stamps, how to get Medicaid,
Yeah.
all of those sort of health and human services.
Is it what is it actually? It's called United something.
I think United Way is a number.
United Way,
is one
yes.
of the other
Thank you.
resources they provide. But yeah,
Thank you, Charlie. I can't remember the other part.
Yeah.
Thank you.
Mhm.
The other resources, BG&E Assistance Program, BG&E Special Needs Program. The federal resources are ready.gov, American Red Cross, and National Weather Service. Um, 311 connects Baltimore citizens, businesses, and visitors with a vast array of city resources, programs, and information. You can also make service requests that can be submitted through that number and the self-service web or mobile portal. Anyone within the city limits can dial 311 to report a problem or request service. Okay, I already talked about the other things. BCHD, which I mentioned at the bottom, is the Weatherization Improvement Program that helps with repairs and rehabilitation, lead hazard reduction, and other housing resources. And the Code Red and Code Blue program offers cooling and warming centers available throughout the city during extreme weather. Okay, so next slide, please. Let's see. Okay, so here is a BMO alert, which is provided by Everbridge, and it's a mass notification system. Bear with me 1 second. That platform allows Baltimore City to respond to, recover from, and weaken the impact of critical events. The alerts go out to the public via phone calls, text messages, and emails. Baltimore residents can opt in for BMO alert notifications through the Nixle portal. The easiest way to do this is to text join to join this program. You can text BMO alert to the number 888-777 below. Baltimore City residents can request. Oh, I mentioned that top one smoke alarms for residents who are deaf or hard or hearing impaired are also available. I chose the right place to sit, obviously. Smoke alarms for residents who are deaf or hearing impaired are also available by calling the fire marshal's office at the number listed, 410-396-5752. Smoke detectors save lives, and we are getting to the time where the smoke detectors, you should check your smoke detectors. So when you see, when we go into the fall season, it's important to remember to check your smoke detectors to see if the battery may be, need to be replaced. Let's see. Oh, so let's see. Let me read this part too.
If
Go ahead,
you'd like
Shelley.
to, so I can add one more thing about this.
Oh, sure.
So with the Baltimore City Fire Department smoke detector program, they only offer and install smoke detectors. The carbon monoxide detectors, we do encourage everyone to have them. But within the city, the fire department only installs smoke detectors because they run on a different battery system from what the carbon monoxide detectors do. So we encourage everyone to get carbon monoxide detectors, but we offer the smoke detectors. And as Crystal mentioned, if you have anyone in your household who is deaf or hard of hearing, any kind of hearing impairments, they can get a specialized smoke detector that assists them, notifying them. I believe the one we have is it's like a bed shaker smoke alarm, where if there is a smoke detected in the a fire, detected in the home, it will shake the bed of the individual who has any kind of hearing or any kind of hearing impairment to notify them that it's time to vacate.
Thanks, Shelley.
Mm-hmm.
Okay, so next we're going to talk about creating an emergency plan. You know, it's important to have a plan because there are things happening all around us. It's on the news. We have more intense storms. Of course, we're going to have more COVID-like viruses. They've been talking about a new virus on the horizon. And so there's always going to be a new virus or some kind of virus on the horizon. So we want to make sure that we're just aware that these things are going to happen. That is one of the first things about preparing for emergencies. And that is being aware that things are going to happen. The next event is going to come. It's only a matter of time. Next slide, please. Next, okay. So how do we go about preparing for the next emergency event? We want to create an emergency plan before the next event takes place. And so we want to have the things on hand that we do need in the event of an emergency. Of course, we have the health information card. The health information card is actually a card where you can put the medications you're taking on it. You know, it has the name of the medication and the amount that you will be taking. And even though we, Baltimore City Health Department and other agencies have a card that you can do that on, you can actually also put it on a piece of paper, piece of cardboard, but just make sure you're putting it somewhere and keeping it on your person, keeping it in your wallet, your purse, also in your emergency kit. And of course, include a health services card. The health services card is a card that have different services that the health department has and other agencies connected to, affiliated, or associated with the health department has. It's different services for seniors, services for teens, of course, homeless services, mental health services, things that where you can get food and other items. So it has an array of information on it. So of course, you also want to plan for the specific needs in your household. Do you have anyone in your household that has a disability? Of course, your items will be different from someone that does not have someone that has a disability. Do you have a child? It's going to change depending on who your household is made of, the people in your household. So of course, the individual ages, their dietary needs, access and functional needs, other medical needs such as prescriptions, daily schedules, the locations frequented, cultural and religious considerations. And of course, if you have pets like I do, I have a big dog and a cat. So I actually was just the other day making sure I have extra pet food because should something happen, should some epic event happen, I have enough food for me and the humans in the house. I don't want to give the animals my food because then, hey, that's distributing it to the animals also. That's another mouth to feed. So I make sure that I actually pick up some pet food. I got a whole huge 20-pound bag of cat food. And I just also ordered some food for Jasmine, my sweet, cute little doggy. And of course, household with school-age children or grandchildren, etc. You want to make sure you're preparing for them. I know I used to work at Southwest when 9/11 happened. Gabby, my daughter, was already prepared for. Someone went and picked her up and took her home. But we had already told her, should something happen, you live across, your school was across the street from where your dad is, you're going to go across the street. So you want to make sure you have a plan because when that next event happens, you may not be able to leave work to go see about your family. So if you're caring for a client, you want to make sure that your family at home is taken care of. They have the food they need. They have the items they need. They know where to find those items. So you want to make sure that you're going over these things with them because essentially you have two homes, two places to take care of, the place where you are working and the home, the place where you live. And also the last bullet point on here is to have a designated out-of-town contact. Because sometimes when emergencies happen, you may not be able to get in touch with the person down the street, across the street, down the corner, in the same area or whatever, because those lines sometimes seem to get jammed, but you may be able to contact someone out of town. I know when we had the derecho, the strong winds, I guess it was in 2011, that knocked down a lot of trees and so forth, I was not able to call people. I called Gabby, I couldn't reach her, but I realized the texting capabilities was working. So sometimes you may not be able to talk on the phone, but you may be able to text. Either way, you want to make sure you do have an out of town contact. Next slide, please. Thank you. This is the health information card I spoke of earlier. The health information card, it has places where you can write down the medications that you are taking and your important health information. And you want to put that important health information there just in case something happens and you are taken by ambulance somewhere. At least they know what medications you're taking. And if you have some heart problems or other health issues that you really want them to know about ahead of time. I knew this lady that she used to live here in Baltimore, but after a while she moved back to like Manchester or one of those places, and she had some mental health issues, and she took medication for it. However, since she was living here in Maryland and Baltimore all those years, when she went back home, they were no longer familiar with her. So when she ended up in the hospital, they gave her something, probably some psychiatric medication that went contrary to what medication she had in her body, and she died. That is a very extreme case, but it's a very real case, and it happens more than you know. So you want to keep a copy of this on your fridge, and also keep one in your emergency kit also. Yeah, and yes, someone asked the question, can we have them mailed out? Yes, we do mail these out on occasion, definitely. And we also have a lot of them in the health department for pickup. If you are passing the health department, you can give us a call and we can have something ready for you. Thank you. Next slide, please. And this is the other card, the health services card. This card has all sorts of really relative and helpful information in it. But of course, the health department being right there on the front, 410-396-4398. And as you can see, it has health department clinics, emergency services, mental health and substance abuse information, homeless services, food and nutrition services, children and infant information, animal protection services, support services, senior services, violence prevention information, and 311 services, which Crystal elaborated upon a few minutes ago. And yes, we have these available for pickup or mailing out also. Next, please.
Alrighty, when we are looking at planning for aging adults, as Miss Bridget mentioned a couple slides back, we want to make sure our plans are specified for those who we are in our households or who we are caring for. So for aging adults, when we're considering their communication needs, we want to make sure our emergency plans incorporate what those needs might be. This could be something such as having, if this individual or if you have hearing aids, making sure you have an extra set of batteries with you in your go kit or with you to take if you have to go to an emergency shelter. Just so, because if this is something that impairs your ability to communicate with others or to hear others, it is something that can impact your safety, your ability to advocate for yourself. So you want to make sure you have that available. Another example could be if you have someone who is nonverbal and they utilize a tablet or some other kind of assistive technology device to communicate with others. We need to make sure that the device is charged, or you have some other means to charge that device, because we do not want to take someone's ability to communicate with others away from them. Looking at mobility and accessibility, if you have to evacuate your home in a hurry, it is best to make sure that your home is clear, there's a safe exit, as well as if the public safety officers need to be called, if you need to have paramedics or fire department come in to provide assistance evacuating your home, having it clear and free of clutter can help ensure a safe exit for everyone in the house, or a safe entry for the firefighters, paramedics, police officers to come into your home. Also, we want to make sure that when we're looking at our evacuation plan, which we'll talk about in a little bit, that we have an idea of how to get out of our neighborhoods, how to get out of the city, as well as what means are we going to utilize to get out of the city. Do we have Do we have a neighbor that we can reach out to that we can ride with if we do not have a car? Do we have a car? And if we have a car, is it fully gassed up, especially in the extreme cold seasons, extreme heat seasons? And just making sure that all of these different facets of your emergency plan are addressed. Looking at the emergency contacts, Miss Bridget touched on that, but again, making sure everyone has an out of city or out of a contact located far away. Another example of why you might want to make sure to have this emergency contact, not only can everyone in your household notify them to give them an update, but if you're like me and your family lives 600 miles away and they can't get a hold of you, if they have an out of town contact that you've notified, then all of your family outside of who live far away can reach out to this one person, and they can ask, have you heard from them? Are they okay? And they can report back. This is especially crucial if and when there's any kind of issues with communication lines. Looking at home modifications, we want to make sure that we are any necessary changes we have to our homes to address our needs. If we have, before I worked for the city, I worked for a nonprofit that helped individuals with disabilities. And we made sure to have modifications to the home to address any kind of mobility issues that they may have. Or if we had residents who lived on the second floor, that they had a ladder that they could have outside of their window if they had to exit their home for a fire drill and what have you. And then just making sure that any kind of home modifications that are done to address the different mobility concerns, that everyone is aware of them and that they practice them. For special dietary needs, we'll go over this a little bit more when we talk about emergency kits, but again, making sure that this is not only the items that you need for your special dietary needs are included in your emergency and go kits, but if you are taking care of anyone who has emergency dietary needs and you have to evacuate them, that they have access to that, what those needs might be. And this might be going into an emergency shelter. And if you have someone who can only have soft foods because they either have dentures or they have dental concerns or choking concerns, any of these kind of concerns, we want to make sure that this is communicated to wherever they're going, and that we as their support staff and that we can advocate for them and that they are capable of advocating for themselves. This also can include different religious dietary considerations. Again, if you are of a specific faith, there might be, if you are, for example, you might be Jewish and can only have kosher food. So you want to make sure that this is notified. Again, if you're in a shelter, this is something by law they need to be providing for you. So you want to make sure that is communicated. And then for mental health concerns, we want to make sure that if there is any kind of, let's say we have an elder adult who may have sundowning or any kind of mental health concerns that might happen at certain times of the day, that this is included in the plan, that people know where they might be going. They know that this is something to monitor for, as well as being aware that the people that you are working with, if they have certain triggers that might aggravate them, that making sure to just be cognizant of that as you are practicing your plan, if you have to execute your plan, just to, again, ensure their safety and the safety of others. So when we're looking at planning for children, I know the community that is attending this meeting and that is receive supports from EPN is often our seniors or individuals with disabilities population. But what we want to remember is that the staff who are providing care to these individuals, they have families outside of work. While work does it can be your second family, your second household, you want to make sure, as Ms. Bridget stated, that you have a plan for your household outside. So if something happens, if there is a sudden storm where you're not able to leave work, that all of your needs at home are addressed. And this can also include having things like a family communication plan, having emergency kits, having everything at home available. That way, you know that they are good, because If we are worried and stressed about what is happening at home, we cannot perform to our best abilities at work. And this can be a danger for those that, not only those that we support, but any possible colleagues that we're working with. So again, we just want to make sure those are all of those measures are taking place and everything is prepared. Oops, sorry everyone, I went too far. And again, like we mentioned, for the homes that we're working in, we want to make sure that we also have the health information card and the other cards available for people to utilize and have for emergencies. If I may give a pretty serious example of the importance of those emergency cards, Baltimore City, in July of 2023, we provided support to the Brooklyn Homes mass shooting during the recovery efforts. And one of the things that we had on our table for resources was the emergency card, the wallet-sized emergency card, which is much like the health information card that Miss Bridget provided earlier. And we encourage everyone to have extra copies within their kits at home, but even having them in your wallets or purses. At the Brooklyn Homes mass shooting, there were a ton of teenagers who were attending that party that late that night. And like most teenagers or most anyone, your cell phone is almost always going to be in your hand. And in this event, when things got really bad, everyone in panic, as you would, they dropped their phones and they were rushing to safety. Well, when the police were there to support them, to help them get reconnected, reunified with their family, they couldn't remember their phone numbers, and every emergency number that they had was in that cell phone because that's a handy place to put it. So we highly, highly encourage, and the many of the parents that I spoke with while we were there were incredibly glad we had this resource. It's a way to empower you and your family and your children. That way, you have a backup to know everyone's numbers. Because again, when we're in a heightened state, whether it be because of a incident such as that, a tragic incident, or any kind of natural disaster, we're not going to be thinking as normally as we would on a blue sky regular day to day. So we want to make sure to have those cards. So looking at the evacuation plans, kind of touched on that a little bit. The evacuation plans that you have within your community emergency plan, your emergency plan should include all your fire alarms and or emergency exits. You should have a designated outdoor meeting place so everyone in your household knows exactly where to go. That way, if and when you have to evacuate for a fire or any other issue, you're not searching for everyone and you all are there, everyone's safe. And then again, we've mentioned the escape routes that are out of your neighborhood or city, and these can be found on DOT's website. A lot of these resources we're mentioning, when you receive the PowerPoint, you can click on them and it should give you a link to these sites. And so the Baltimore City evacuation routes are very similar to the snow emergency routes. So they have them on the exact same map. So I highly encourage people to go on to that website, download it and print it for your emergency kits. And then as always, we want to practice and review our plan at least once per year. It might even be the standard where you're working to do some plan either quarterly or even monthly to try to practice and prepare for any possible type of threat or hazard.
Okay, so next we're going to talk about building a kit. And I cannot actually even stress the importance of this. We're living in a world where things are changing rapidly. So rapidly that I do have a headline to read to you. Newsweek and others, CNN and others have been posting this on their sites. It's talking about the ports. I'll read this one headline. It says, dock workers at key U.S. ports threatening a strike that consumers could feel. And another headline reads, A port strike is looming over the U.S., Georgia chief says. It says this strike would bring operations to a halt at 36 ports, responsible for handling nearly half of the nation's shipborne cargo. So what's basically happening is the number of the port workers are threatening to strike, and they are planning on doing this on October the 1st. So of course, we do not want anything like that to happen, because the strike could interrupt the things, our food supply and other supplies coming into the stores in our cities. So it could have a great impact on the way we live and the things we buy or the things available to be bought. So there are things happening around us. And we are also, and I can't emphasize any more than this, that we are going to continue to have weather events. I believe we may be heading into a perfect storm of events, meaning all these different things could be happening at the same time. We're going to have weather events. Of course, we're going to have more events like COVID, economic abnormalities and catastrophes, possible civic unrest events, food scares and possible food shortages should this port event happen. So we want to make sure that we are having the items that we need in the event of an emergency. So you want to build a kit. This is Plan 9. This document is a trifold. It looks exactly like you see here. It's a great picture brochure that shows the 9 essential items in an emergency kit. And of course, number 1 is water, making sure that you have enough water for you and your family. And this water is not just for cooking, but it's also for bathing, keeping for your animals, and you're going to be using it for your whole household. So the recommended amount is 1 gallon per person per day. And the recommended amount was for like 3 days. But the way things are going, I encourage you to get enough water for your household to last a week, 2 weeks, 3 weeks, however long that you can, your money will carry you. Have enough water. You don't always have to even buy your water. You can boil your water, allow it to cool, and put it in some containers. So water, when you go to the grocery, make sure you're picking up an extra case of water. I picked up some extra cases just the other day when I went to the grocery. Making sure you have enough food, canned goods, dried goods. I buy canned milk and dried milk because if an event happens and the lights go out, everything in the refrigerator, unless you are drinking or eating them quick enough, which could spoil, right? So you want to make sure you have canned goods, packaged goods, nuts, raisins, and other items. Rice, you can have both canned goods and dried food. I have a lot of beans in my closet in there, pinto beans, black-eyed beans, lentils, you name it. I have it in there. I have both dried and canned. So you want to make sure you have enough water so you can cook the items that you have. And hey, I hope we don't have to do this, but if the lights go out for any extended period of time, you may have to have a means to cook those things outside, whether you have a grill or some other means. Of course, clothes, keeping these items in an emergency kit that's easily accessible, keeping it by your door or some place where as you walk past it, you see it all the time. So you know where it is, right? And I keep these items in my car. I keep a backpack with items in my car, food, clothes, water, the whole 9 in my car. And of course, we spoke earlier of medications, the health information card, where you can put those medications inside that card. Also, making sure that we are getting our medications filled on time so that you have extra for emergencies. I just got my medications filled the other day. I also have things like Excedrin because I get quite a few headaches. So I want to make sure that I have Excedrin for my headaches. Also, a flashlight with extra batteries. I just actually recently, shall we say about 3 weeks ago, purchased 100 AAA batteries and 100 AA batteries on Amazon. I won't be running out anytime soon, but it's a great idea to have extra batteries. Should an event happen, oh my gosh, people will want to barter with batteries and lighters and things like that, right? So you want to make sure you also have a can opener to go with the canned food. Some of the cans have pop-up tops, but not all of them do. And I was doing a presentation one day and a lady asked me, well, can I eat the vegetables or the canned food right out of the can? I said, yeah, you can. It's better if we warm them up. We love them warmed up, but we can definitely use them and eat them right out of the can. Also a radio, personal hygiene items, and a first aid kit. Next, please. And of course, additional items. Shelley spoke earlier about a power bank. You want to make sure you have an extra charger for your phone. You can get some of these items on Amazon or Target or some of those other stores, Walmart or elsewhere. They have extra chargers for your phone. Paper and writing utensil, a copy of your family emergency communication plan. Make sure you're practicing that plan and everyone is aware and know that plan. A whistle. Sometimes you may not be able to speak very loudly or yell, but you can blow that whistle. So make sure you also have a whistle. Cash. Our grandparents, our moms, our dad told you to have extra cash on hand. If the lights go out, you will not be able to use your ATM card. So you want to make sure you have extra cash, or you're going while it's time and while you can, and take some extra cash out of the bank and keep it with you. Some matches, fire extinguisher, hand sanitizer, of course, masks. We've been using them during COVID. It's still a great idea to keep masks. Some extra masks, right? And printed copies of important documents. Maps, man. If something happened and you can't use your computer, your phone, you're gonna need a map. So make sure you have some printed maps. Also, IDs, insurance policies, and bank records. And to add to this list, some duct tape. Duct tape goes a long way. And of course, for fall emergencies, you want to make sure that you're planning for flu season. Tissues, hand sanitizer, fever reducing medications, cough and cold meds, electrolyte drinks, so you can build back up your system. Also face masks and gloves. This is what's on your hands. We also have this brochure available if you'd like us to send you some, or if you wanted to pick them up yourself from the health department. Next.
Thanks, Ms. Bridget. Kendall, can you, for some reason I can't do my, okay. So the types of kits to have are shelter in place kits for your home, go kits for your car, or to evacuate your home. Emergency kits for work are also recommended, especially if you have the kinds of jobs that we have online, emergency management, where we may have to stay later because of a local emergency or disaster. So we have a lot of stuff in our cars and at work as well. It's also a good idea to check your kits at least twice a year and replace or add items for different seasons. The Go kits should be easy to carry and should be kept in an accessible place that is easy to reach. And then while checking your kits, swap out the items. I believe I mentioned this already. Yeah, swap out the items to match the upcoming season, and even check the water or check the food items to make sure they haven't expired. Practice. Practice and review the plan at least once a year to update and refresh your memory. Think of it as, like, for instance, children that have fire drills in school. The staff at school wants to, sorry, just piggyback off of what I just said. The staff at school like to make sure the kids know where to go in case of fire at the school. So you want to make sure your family knows what to do in case of an emergency at home, or Okay, thank you. Scenario time. Have a scenario. So, a storm has led to power outages in your area. If you or someone you support is relying on electrical medical devices, what plans should you have in place? You could put your comments in the chat.
Or if anyone would like to raise their hand or even come off mute and give us a couple examples of what sort of plans you might want to have in place, what additional things would you want to have if you or anyone in your household or anyone you're taking care of is reliant on durable medical equipment. What sort of things do we think we might need?
And even piggyback off of something that we mentioned already, maybe have it in a communications plan.
I will, I know we're short on time, so I'll help everyone out here, give some examples. So one of the biggest things that we want to do, and depending on what kind of home you might be in and the licensure or any kind of regulatory entity that might be overseeing it, anyone who's in a home that receives any kind of, or is reliant on any kind of durable medical equipment they're going to want them to have some sort of generator or additional battery packs. If they're on oxygen, they might need to have a backup oxygen tank that is fully charged and able to be used without having to plug it in. So having a portable oxygen tank is helpful. Other things, we mentioned the BGE program earlier regarding people with special medical needs. You can use the link that we provided to register your household. That way BGE knows that you have these additional needs. And what they usually do when they have, or what they can do from this program is if there is a planned outage for your area, they can notify you, as well as if there is an outage and you are relying on power for your medical and health needs, they can try to put you as far as top priority with all the other critical infrastructure like hospitals, nursing homes, etc. But again, we highly encourage people to check out that website to find out those resources. So we'll go on to the next one.
Okay, so you're working with an immobile patient who lives in a flood-prone area. The weather forecast calls for long periods of heavy rain and a risk of flash flooding. So what steps should be taken before the storm arrives? And what should their emergency plan include?
I can help everyone out with this if you'd like me
Okay.
to. Again, just having a evacuation plan in advance, knowing with those contacts in town as well as out of town, and then making sure that you're practicing it. So in this stressful moment, you are a little bit more at ease. We understand there is going to be some anxiety when it comes to situations such as this, but having it planned out, knowing what you're doing, learning it more, making you more comfortable with it can make it easier for if and when the time does come. And so I believe our last one I'll go on to is talking about having someone with a chronic respiratory issue where there could be a sudden drop in temperature and the heating system fails, or there's a power outage. We have had that just a couple Christmases. I think it was Christmas Eve a couple years ago. It was -5 here or 10 degrees. It was incredibly cold and we had a ton of power outages. So we want to make sure that we know what sort of risk could happen, are we looking at if something like this happens, and then how can we plan for this? What sort of things can we do to mitigate this problem? So if your heat is out but your power is still working, do you have a backup plug-in heater? I have one that I needed once. It was incredibly cold out. I went to the gym and I came back and my house was 18 degrees. So I had that heater to keep me warm until my maintenance could come and help figure out what's going on. So just thinking about what are these different items. Do you know where the warming shelters are within the city? The city has cold blue warming shelters as well as code red cooling centers in the different seasons that can be accessed by the public to use to warm up. And then like with that situation that I mentioned around Christmas, we did open up a shelter to have available for people to come if they needed to. I believe we didn't have anyone, which I think people's power and heat was starting to come on, and it was the holidays too. So, but we do try to provide those supports. But if and when those supports aren't there, you want to make sure you have those plans set in place to mitigate those issues. So I think we're after time, but are there, I will hand it back to Kendall.
Sure. I have a question for you before we wrap. So in terms of the heating and cooling centers, is that information readily accessible on the Baltimore City information card that you mentioned earlier, or where can the public access that information?
Health Department does have a list of all the heating, the cooling centers. Like mostly we'll use a lot of the senior centers, and it should be actually on the Baltimore City Health Department website.
Okay.
And then I'll just add to that too, sometimes just like everyone else, we can have issues with our HVAC systems too. So usually what'll happen before a code red alert, which is where the heat is at a certain temperature that it's crucial and can impact health, they will send out a press release the day before. And this will list the various resources that are available in this city. And the reason why they list them every time they do it is because we have had times where a rec center or a senior center that was being utilized has had its own HVAC issues. So we try to direct people that where these are at and the names with the addresses. For Code Blue, we have a couple different ways we look at it because our Mayor's Office of Homeless Services has some Code Blue additional shelters that they open for people to stay in at night, as well as some warming centers listed there. But I would, like Ms. Bridget said, look at the website, and then as well as following any of our social media accounts. Within the city, we try to reshare each other's social media posts for something that if the main agency lead would be Mayor's Office of Homeless Services for something like that, or if we're looking like Code Red, it would be the Health Department, and then we would all reshare that information.
Yeah, and if I could add one thing, I think it's a great idea while we're in calm before the storm or nothing is going on to go and access the health department site to see where these places are. And you can write down the ones that are closest to your particular area. And then when we had that very intense storm the other day that knocked down a lot of trees, people were going to the grocery. I live close to ShopRite. People were going in there and trying to charge their phones and so forth. So some of the groceries and other places have agreed to be like cooling centers. So you